Welcome back to one more session of Lean in RCM. And today we are going to cover what is the denial related to the patient age. Okay, let me share my screen and then I'll start that detail. So we are continuously discussing on this particular part, Lean in RCM. In that, we are going to cover today how we are going to solve the problem when it is relevant to the patient age, right? That's what we are going to cover today. See, when it is coming to the patient age, so what is the issue here? See, for example, whenever you get any of the denial related to the patient age, what it mean is the claim are billed with the two different major category. One is the CPT code, other one is a diagnosis code, right? Either your diagnosis code is not matching with the patient age or your CPT code is not matching with the patient age. That is very simple. It's a coding related error. That's what we think, right? That's a major issue. So what we'll do, we'll go back and then check and confirm the denial category and check the patient age from the demo and check the policy for the CPT and diagnosis. So usually the CPT code will mention what is the age of the patient, this particular CPT code or diagnosis can be done. So we'll go back and then check that particular policy and we'll identify whether your denial is right or wrong. If the denial is incorrectly denied, for example, I am receiving a payment previously, in that scenario, we will send back for reprocess. If the denial is correct, we have to send it back for the coding review and corrected claim with alternate code we will bill and then we have to refile the claim. This is a general procedure of the patient age. See, the two things we have to understand, right? How we can avoid this particular denial using this particular lean methodology. Okay, so if you consider this, we will go with the what all the things are called NV, that is non-value add, and what all the things are coming under the value add category. See, for example, getting a denial and related works are considered as a non-value add, right? I'm not going to make any money out of it. And when it is an incorrect denial, I'm going to send it back for reprocess. I'm going to make some value here. And for example, I'm sending this to a coding review. There are two problems here in this particular claim. See, whenever you have a infant services, right? It's a pediatric services. Usually what will happen, a newborn baby billed with the mother's ID number. So because the baby will not be enrolled or not added as a dependent, 30 days we have a time frame. I can bill under the mother's ID number. So when the mother's ID number is getting billed, there is a billing logic need to be checked. Okay, you have to find the billing logic and you have to correct it here. Otherwise, what will happen? This patient age denial will come. Okay, if it is not a newborn baby, it's a regular practice. Still, I am getting this particular problem. This is straight away, it's a problem with your coding. So what we need to do, we will add that coding. We will give an interim arrangement and the permanent solution. What I'm going to do. See, when you identify the particular CPT code or diagnosis cannot be billed for this particular age, what we'll do, we'll run a report and then add the DX and CPT list under the pre-billing audit review. And then we will make sure that it is getting corrected in the charge level itself so that we will put a edit. So this is stopgap, right? I run a report on the charge, go back, identify, filter by the CPT code or filter by the diagnosis code, go back and then check the patient age and then fix it. The permanent one problem with the charge review is you won't get the date of birth in many of your charge reports, right? This will become a manual work. You have to go back and then check one by one. That is one problem in this stopgap arrangement. In the permanent one, what we can do, we can create an edit in the PMS. Whenever this particular code is coming in, we can stop there itself so that it will be easy for us to check and then bill it. So this is about the lean way of billing. So if you ask me the patient age, is it a bigger denial? No, it is not. We will get very, very limited denial for the patient age. When it is an infant, you may get it. Or sometimes the geriatric practices where the aged patient treatment, you may get these kind of denials. Right? Apart from that, the patient age is a very, very minimal denial and you won't get much. So the lean way, how to avoid? First thing, do a review, identify the problem, go back to the charge entry and then fix it. Second one, create a edit in your PMS so that the claim will go out as a clean claim, right? This is what we have today. I hope this will be very simple and then straightforward denial. There's no complication in this particular denial.